Non-English speaking population: Health Concerns by Christina Lacombe. Vulnerable populations include minorities with economically disadvantages, racial and ethnic minorities, people that don't have insurance, low-income children, the elderly, the homeless, those with human immunodeficiency virus, and those with other chronic health conditions, including severe mental illnesses. Minorities that don't speak English well, or don't speak English at all, are considered as vulnerable populations too. Regardless of advances in translation technology, the language barrier establishes a significant amount of vulnerability to poor health outcomes. "22.47% of Ogden, Utah residents speak other languages than English. 14.78% of Utah residents speak other language than English. In 2013, approximately 61.6 million people that were born in the US and foreign-born spoke a language other than English at home, that is approximately 20.7% of residents. In the world, 1.5 billion speak English, that is 20% of the Earth's population. Percentage of populations that speak other languages than English in Ogden, Utah is a little bit higher than nationally. The World Health Organization defines social determinants as a condition in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the condition of daily life. Social determinants of health can be neighborhood and built environment, health and healthcare, social and community context, education, economic stability. Patients with limited English proficiency usually experience difficulty in communication with the provider, higher rate of medical errors, low comprehension of medical diagnosis and instruction, inappropriate diagnosis and treatments, worse health outcomes than English-speaking patients, receive lower quality of care, and less likely would have follow-up. Community-based clinics and small private practices don't make use of professional interpreters due to high cost and inconvenience. The socioeconomic status may have impact on access to health care too. Usually, basic human needs often have priority before health needs. When family cannot provide basic needs such as food, pay the bills or the rent, getting health checkup becomes secondary concern. Short-term thinking and poor decision-making due to unmet needs. Unmet needs directly related to tension and anxiety. By helping a vulnerable population to meet their basic needs, we can increase their mental capacity, and they will be able to focus on long-term goals, including health goals. Racial and ethnic minorities are at the greater risk in a pandemic because of the social factors susceptible to complication, and they usually delay in seeking health care due to the social economic status and language barrier. They have higher rates of hospitalization. There are four most common non-communicable diseases. It's a cardiovascular diseases, cancer, chronic respiratory diseases, and diabetes. Social determinants of health correlated to the life expectancy. Usually provider even unable to obtain accurate health history. This population have exacerbation of chronic condition, They have a greater chance of readmission. They usually lack of health insurance, and there are less information that is available concerning the health status of other non-English speaking populations. Unresolved language and cultural barriers can cause misunderstanding of patient diagnosis, treatment, and healthcare options, discharge instruction. This population is in risk of misunderstanding or improper use of medication or serious medication error due to the language barrier. They usually have poor understanding of the procedures or preparation for the procedure. This group of people can feel unwelcome and stigmatized. That can cause stress and anxiety. Not having access to health care can have risk of adverse effect on health. More likely, they have co-occurring conditions, substance abuse issues, and behavioral health problems. This group is in risk of morbidity and mortality.